And in the next 30 minutes, Joy News uncovers details of how a private Ghanaian healthcare facility, Frontier Healthcare Services, bagged over $80 million out of a questionable COVID-19 airport testing contract. Tonight, we interrogate the controversial decision to outsource rapid COVID-19 testing at the Kotoka International Airport, with critics launching a scathing attack on management for superintending a rip-off of the Ghana Airport Company. Top story, as always, is brought to you by Vodafone. Further together, I am Blessed Sogah, and tonight, Joy News is beginning to get fine details of how a private Ghanaian healthcare facility, Frontier Healthcare Services, bagged over $80 million out of a questionable COVID-19 airport testing contract at the Kotoka International Airport. For close to a year now, the Ghana Airport Company has been in a tussle with Joy News following a right to information request demanding details of the circumstances under which this private healthcare facility, Frontier Healthcare Services, was outsourced to carry out a rapid COVID-19 testing at the Kotoka International Airport. For many months, the company declined to provide details of the contract, forcing even the RTI Commission to slap a fine of 200,000 Ghana cedis on the airport company. But finally, tonight, Ghanaians will have the opportunity of gaining at least some deeper insight into the Frontier Healthcare Services contract. Head of our research desk, Raymond Akwa, is here with me for some more on this document, which has now been released from the Ghana Airports Company. Raymond, so let's get into the details now by finding out, first of all, the background to this contract. Why was Frontiers Healthcare Limited contracted?
So the question we actually asked was to find out the same question, the chronology of the processes that led to the selection and award of the contract to the Frontiers Healthcare Services. And they added that to the other question about the reasons for the selection and the award of the contract specified to Frontiers Healthcare Services. This was the answer they gave. They said, appearing before the Appointments Committee of Parliament on Tuesday, February 23, 2021 in Accra, the Minister for Transport explained that Ghana Airport Company, which operated the KIA, only rented its space to Frontiers Healthcare Services.
And we need to be instructive on that.
Yes, only rented its space.
Right.
He said that this happened after the FDA had given confirmation on the certification of equipment to be used by Frontiers Healthcare Services. He also recounted that sometime in July or August 2020, the president announced the government's inclination to reopen the borders of the nation to commercial air traffic, subject to the availability of an effective system for COVID testing. Following this, Frontiers Healthcare Services expressed their preparedness to provide such service to the public.
And we need to be very instructive on that point, that from the text we're getting now, the approach was first of all made by this private firm.
Yes, and that they expressed their preparedness to do this, to the testing at the place they were talking about.
Yes,
indicating that its equipment has been tested by the Food and Drugs Authority. Now, the airport company did not rely on the bare word of Frontiers Healthcare Services. It sought to verify and confirm the due certification of the equipment of Frontiers. And on 20th of August 2020, the managing director of Ghana Airport Company wrote to the FDA to confirm the certification of Frontiers Healthcare Services. Explaining further, Mr. Siama, who is the transport minister, because they are quoting him, said by a letter
appearing before
the Parliament Committee, by a letter dated August 25, 2020, the FDA wrote to the Ghana Airport Company, indicating that it approved the equipment of Frontiers for use for the detection of SARS-CoV-2, that's the COVID-19 virus, in Ghana. The on-site audit report carried on the equipment was attached to the letter, he noted. He further informed the Appointments Committee the following receipt of information: that the Ghana Airport Committee, intending to enter into an agreement with Frontiers, wrote to the Public Procurement Authority to seek its approval before executing any agreement with Frontiers Healthcare Services.
I see.
However, interestingly,
yes,
by a letter dated August 26, 2020, the PPA replied to the Ghana Airport Company advising that the rental of office space by Ghana Airport Company to another company fell outside the scope of the PPA Act.
So this is the very first time that the airports company itself noticed that something was amiss, actually,
yes,
with the contractual arrangements of this.
Yes, so they said before they contracted the Frontiers people, they asked the PPA for advice, and the PPA indicated that renting an office space to somebody fell outside the rule, that required you to go to the PPA, and that they should use their administrative processes to execute the transaction. Consequently, on September 1, 2020, Ghana Airport Company entered into agreement with Frontiers to rent its office space to the company for consideration. The Minister for Transport designate further noted that the agreement was essentially for rental of office space, and that some paragraphs in reference in the agreement bear out this, since the consideration payable by Frontiers was simply for the payment of rent and service or utility charges. In the said agreement, he also moved on to say the airport company entered into with Frontiers. The transport minister designate further revealed that the laboratory service provider was also required to make a payment of royalties of $10 per each test done to the Ghana Airport Company. But the payment of royalties did not imply that the agreement had to receive a PPA, that's the Public Procurement Authority approval. He also added that a precondition for an application to the PPA Act, and for that matter, obtaining PPA approval, is the use of public funds in the procurement of goods, works, and services. But that Ghana Airport Company did not procure the service of Frontiers with public funds. The company offered to provide laboratory services to the public with their own equipment. No public funds were expended in getting them to provide the services to the public, apart from the provision of office space. Thus, the basic condition for an application for a PPA did not exist.
How about the issue about the fees being charged? Because obviously, if you're charging fees, it must have been approved. Is the Ghana Airports Company providing some clarity on that?
No, the question was asked, and they said in their agreement with them, what they agreed was that they were getting a $10 fee, and that specific
for renting.
Yes, per each test done.
Okay.
To the Ghana Airport Company Limited. Right. So this is royalties you are paying to us for getting the space that we gave you. Now, they told us the details of the amount you are dealing with here. First and foremost, they said that as of September 9, 2022, when we had asked for the agreement and these details, the total amount of the revenue generated from the COVID-19 testing at the airport from the inception of the agreement with Frontiers amounted to a little over $90 million for arrival testing, and a little over 30 million Ghana cedis. Right. So the arrival is in dollars, the departure is in cedis. So the departure is 30 million cedis. The dollar one is the 90 million for arrival. Now the question was also put to them. So how much did Frontiers get? And how
precisely, because we need to know how much we're getting as a state.
So they stated categorically that from the inception to the date, that is September 9, 2022, Frontiers got $84,016,500.65 for the arrival and 29,176,020 CD for the departing testing. So 84 million basically dollars for arrival, 29 million cedis for testing. Then we also asked, so how about the Republic of Ghana through you, the Ghana Airport Company? Then they said the revenue generated to the government of Ghana from COVID-19 testing was 5.999.749.33. That is 5,999,749.35. a little under 6 million US dollars for the arrival testing, and 580 for the departing one.
In fact, Raymond, you need to stay with me because there's lots of reactions. Greeting this very controversial contracts that we're learning of, and in fact, this will be a series that will be running and bringing you bits and pieces of the very shocking details that we're learning out of this controversial contract. But for those of you who haven't heard as of now, the private firm Frontier's Healthcare Services is now going home, Raymond, with a little over $80 million.
84 million specifically for the arrival testing, and some 29 million for the departure testing. So that's the two that we are dealing with there. 84 million for arrival testing, 29 million for departure testing.
And in fact, even in Parliament as we speak, many members of the House say they are concerned about this very contract arrangement. Raymond Akwa is head of our research desk. Also with me now and joining us via phone is the MP for North North, Samuel Okudzeto-Ablakwa, as well as Dr. Kwame Sapong Asiedu, who's a CDD fellow, also joining the conversation. We'll be getting some clarifications from the Ghana Airports Company, which is also having a few more interventions to make on this matter. But I want to hear from you, Honorable Samuel Okudzeto-Ablakwa. You earlier this week and a couple of days ago has been chronicling some of the issues that you personally have found out as part of the components relating to this controversial Frontiers deal. Now we're getting a fine detail of how much the company is making. Some, Raymond, once again, 84 million
for the arrival testing, then 29 million cedis. $84 million, 29 million cedis. Put them together. That's how much Frontiers got.
And Mr. Okudzeto, you say this is a rip-off?
A total rip-off. And let me commend you at Joy FM for your persistence, your dogged determination. You are dealing with an organization which has been very evasive, which has refused to be transparent and to be accountable. It has taken you a great deal of work to get them after an RTI commission ruling and a fine. And that is not the kind of conduct we expect from public officials. So first of all, we must condemn the conduct of officials at the Ghana Airport Company Limited, the board, the management. They should bow their heads in shame. The Ghana Airport Company belongs to all of us. You are taking decisions on our behalf. If you are not proud of the decisions that you take, if you will not be proud when it goes public, then don't take those decisions.
Okay, Mr. Blakwa, you might want to just hold on for us briefly. Of course, we'll get into your concerns and to understand why you're coming from the perspective you're coming from. But also joining us now is the board chair of the Ghana Airports Company Limited, Mr. Paul Adomotri, who's also a veteran broadcaster, joining this conversation. Mr. Adomotri, thank you for spending some time with us here on Top Story. You just heard Samuel Okudzeto-Ablakwa, the MP there, raising initial concerns even about the arrangements. Frontiers going home with some $80+ million. There's the issue about the revenue distribution between Frontiers and also the Ghana Airports Company. You do a percentage breakdown, and that's bringing us to some 93.3% of the income going to the private firm and 6.7% coming to us as a state. Can you clarify the basis for this sharing ratio? How was it determined?
Thank you very much for the opportunity. I'm wondering why you have put so many seconds on the program, but that's okay.
It's for the obvious reasons, I understand.
I'd like to begin with Honorable Ablakwa's concerns about the so-called, what he describes as irresponsibility of the company, not responding, etc., and occasioning a fine. Now, that's not correct. It's not correct to say the company was irresponsible. What happened is that if you look at the RTI law, there's a portion of the law that says that where the information is sought, It's already in the public domain. The person who is being asked for the information can refer those seeking the information to that document. Our understanding of the matter is that the Minister of Transport has spoken about these matters not on one occasion but on 2 occasions before Parliament. It is found in Parliament hazard. At his vetting, the minister's hearing before the Appointments Committee of Parliament, these questions came up and he dealt with them. And then again, there was a question on the floor of the House by no less a person than the Minority Leader, the Honorable Idris Haruna, as he then was. And our Minister for Transport dealt with it. So the matters were in the public domain. As a matter of fact, Joy FM had occasion to discuss a certain ratio of 20 million and 1 million at the time. This discussion was extended, and many other radio stations discussed it about the person who is doing the testing at 20 million and DSCL is Ghana Airport Company Limited. DSCL got 1 million. So the issues gone on at the airport relating to testing had been matters in the public domain. It was our considered view, and so was the view of our legal team, that we should write to the RTI Commission and cite that part in the RTI Act that the matters are already before in the public domain. And therefore, if Joy FM, CTFM, Peace FM wants the information, they can access it from Parliament Hansard. Now, the RTI Commissioner took a different view of the matter. I'm happy to report that last week we met with him and told him that this is our view of the matter. He gave us his view of the matter. After Georgia, we felt that, okay, fair enough, we will respond. So it's not correct to come on radio and call people names.
But of course, the accounts now are a bit conflicting because from the team, yes, Raymond, you want to come
specifically, the response on the September 19th letter, which was sent to us, that was the first response from the airport company, was that it was exempt. Then they proceeded to actually tell us some of the reasons why they believe it could not be given to us. And the reasons included that they were not the ones who did the testing, who did the collection of the money at the airports. They didn't say that the information was in the public domain. They also proceeded to say that they were not privy to that particular list of reasons. At no point was this issue about information being in the public domain raised in any of the responses to us.
Mr. Adomocho, you want to respond to that?
Yes, and in addition to that, Raymond, it is also important to emphasize that it is not accurate to say that this information is in the public domain. It is not. We have been asking consistently about the full contract.
I'll give you the opportunity shortly. I just want Paul Adomocho to deal with that for us.
Was made in total by
Paul Adomocho, sorry, let's listen to Paul. I'll give you all the
never been in the public domain.
Hello?
Yes, Paul, yes.
Yeah, can you hear me still?
Yes, you're live.
Okay, so when we say it's in the public domain and someone says it's not been in the public domain, it is for that reason that the document that was read in your studio is a reference to something the minister said on the floor of the House of Parliament. If something is said on the floor of the House of Parliament and is captured by the parliamentary hazard, and another person says it's not in the public domain, I'm at a loss. What is the parliamentary hazard document is not public domain. I don't understand that. The document that we have sent to you, we are quoting from the parliamentary hazard, which is a public document.
What are you quoting? What are you quoting? What information is contained in the hazard? And what are we looking for? That is the issue.
Okay.
What you are quoting from the hazard.
So let's then deal. And gentlemen, because there are so many issues we're stressed in terms of time. Let's do this. Paul Adomocho, you'd have to deal with the issue about capacity. It's also coming up strongly. The fact that you have Noguchi and other research centers which we have in this country who could have provided the same service. Are you able to deal with that aspect for us as to why Frontiers was outsourced?
I was hearing the Honorable Ablakwa. I don't know I didn't hear what you are saying. Ablakwa said that the matter is not in the public domain.
Yeah, can I clarify that point?
Yes, quickly.
Yes, please.
Yes. Until this point, we have never been told how much in total Frontiers made. That specific information has been requested. We have never been told how many people
Can I come in?
Frontiers tested.
Okay, can I
those numbers have not been provided. You don't just say that, there's some information in the hands that so the matter is in the public domain.
Right.
Specifically.
Okay. Right. I get it. Paul?
Consistently,
Yes.
I have done that right from the appointments committee in Parliament. And those specific requests have not been
we'll give you ample time to also advance your arguments. Let's listen to Paul Adomotri explain the issues to us. Then we'll give you the floor, sir.
And does not mean that what we are looking for has been in the public domain.
I get it. We'll give you the time to do that. Paul, let's hear you.
Yes, I'm saying that what is concerning Honorable Ablakwa is easily resolvable. So when the minister went to Parliament, the question was asked. He answered the question after the time of the testing. So you might see disparity in the figure because the testing is ongoing. So testing results of Monday, in terms of how much money anybody has made, how many people have been tested, will be certainly different from Friday. So what your Joe FM's letter is as of September. The minister's appearance before Parliament was much earlier. He was asked that as of today, and that's when the minister gave the information of the 20 million to 1 million, which you discussed, other radio stations discussed. That is at the time that the minister was being vetted, because the testing is an ongoing process. So every day the figure changes. I thought this was easy for everybody to understand.
Okay, but let's deal with the issue about capacity, as I was asking.
No, I'm saying this issue about calling board members and management reckless has to be dealt with, because
I get it, but I want us to make progress. I want us to make progress. But
a human being and his work.
I want us to make progress. That's why I want us to deal with the aspect. That's why I want us to deal with the aspect about capacity. I was just asking the question on capacity. The fact that we have local firms, I'm talking about state agencies that can carry out equal research and also testing at the airports. I'm wondering why the company was flippant about that, if you may allow me to use that word.
I don't understand what you are saying, because you have not resolved the issue of board members and management being reckless, or matter that they were not reckless.
That's just by the side. I want us to address other concerns that are associated with the contractor.
I understand that, but if it's your integrity that is being impugned, you wouldn't say we should address other questions. This is very important.
So Senator, I agree with Paul. Senator, if I can come in, am I on?
Yes. I want us to deal with that aspect.
I agree with Paul that we must discuss this recklessness of the board, and I insist. I'm even going to deepen it and highlight. I
get that part. But
if you read their own response, and Paul Adomotri is being disingenuous, their own response, they stated clearly, we've all read it, that information is exempt, that the monies were paid to Frontiers. Today he's telling us that the reason why they were not willing to be forthcoming as public officials under a transparent and accountable regime as the Constitution expects of all of us. You say that conduct is not reckless. Now you are changing the goalpost, saying that you took the considered view that the information was in the public domain. But that's not what you wrote. That was not the justification you provided for refusing to respond to the RTI request, for which the RTI Commission fined you. So that is not conduct we can celebrate. It is not conduct we can glorify. And I insist that, particularly for Paul, who is a senior journalist who we have all admired for many years, I must add until recently, it's not conduct that we should praise. And I'm happy to stay with him on this matter.
Okay, can I come in, Joe FM? Can I come in?
Okay, go ahead, sir. Okay. And just to point out that Kwame Asie's point is still with us.
I've already told you. I've already told you that we had a conversation with the RTI boss about this. The point Honorable Ablakwa makes about the fact that, and Joe FM makes the point too, that we said that the information was exempt. Yes, we certainly said that. When Parliament passed the RTI law, they put in exemptions. Why did Parliament put in the exemptions? So that if a state agency says that we are exempt, that means we are reckless. The Parliament put up an RTI law, ABCD, and said that EBS is exemptions. Where the information is XYZ, it can be exempted. Where so and if a state agency receives a request from an important media house like Joy FM, and we look at it, and our legal view is that, are we not exempt? We are exempt. And then we say we're exempt, and RTI Commissioner tells us, no, you are not exempt. And then we say, well, but the information is already there. He says that, well, therefore, let me explain to you what the RTI Commissioner said. He said, whilst the information may be in the Hansard, the Hansard is not the document of the Ghana Airport Company. Therefore, as far as his legal opinion is concerned, Ghana Airport Company cannot avail itself of that because the Hansard is for Parliament. So that if the request went to Parliament, Parliament could have told Joy FM that it's in a Hansard. But Ghana Airport Company, that cannot say it's in a Hansard because the Hansard is not for us. If we had a newspaper that we had published it in it, then we could have said so. This is what we understood. And we are a growing society. We have done a new RTI law. Thanks to President Akufo-Addo and his anti-corruption, he has passed an RTI law.
So that's so it appears that that's out of the way now.
Blackwa is speaking. Let me finish. I'm saying that thanks to President Akufo-Addo's anti-corruption instinct,
the point.
He is the only president of the Fourth Republic who has passed an RTI law.
So now let's deal with the contract proper. Paul, we are running out of time. So let's deal with the substantive issues surrounding the contract itself, because that's also critical to look at. I was asking about capacity, and then because of time, I was just tying the point about even the necessary licensing and registration for the firm at the center of this. There's, for instance, the aspect about HEFRA, which regulates health facility institutions across the country. The argument is that even this company that you outsourced failed to get that license even at the start of the award of the contract. So how do you tie that in to local capacity, having Noguchi and the likes deal with that, and also the integrity of the company itself?
Hello, is it a question for me?
A question for you, Paul Adomotri.
Have we overcome the integrity issues, which are very important?
I think the point is well made. So let's deal with this now.
He called me, so there's no problem about it. Let me put on record to listeners this question about HEFA or whatever. I already dealt with it with your reporter. However, as far as this interview is going, an integrity issue has been raised. A recklessness name has been called.
Paul, we've gone past that. Paul,
we cannot go past it because the RTI law allows exemption.
Yes, I appreciate that. Just answer my questions for me. Let's deal with that, and then we can get back to it if we have some time. So the issues about the necessary.
If your father was on the board and is being called reckless, you won't jump this.
I get that. I appreciate the fact you've really shout that.
The RTI Commission has already ruled on your conduct at the board, and has said that you got it wrong.
Okay, Paul,
that you could not deny.
Because you are all trying to make your points. We're not able to have a healthy discussion. We'll in fact deal with this proper. Let me bring in Kwame Sapon-Asiedu, who's with CDD. He's a research fellow with CDD and also understands public health matters. Kwame Asiedu Sapon, thank you for joining us. Your thoughts also on what you've been hearing so far?
Thank you, Blessed. I find everything going on, and I do, because to be a contract between Frontiers and anybody for the biomedical testing that you have, the airport authority renting the space, just having a license from the FDA, has with Frontiers for the actual biomedical testing, to be able to take patient biomedical products and test.
Kwame Sapon-Asiedu, we seem to be losing you intermittently. If you could just reposition yourself for us again. Okay, we'll try and work the lines of Kwame Sapon-Asiedu shortly. Paul, let me get back to you one more time. The issues about capacity, the issue about HEFRA, how do you deal with that, sir? Hello, Paul Adomotri. Let's see if Samuel Okudzeto-Ablakwa is still with that. Honorable Samuel Okudzeto-Ablakwa, you were making a point earlier. Okay, we've lost Samuel Okudzeto Ablakwa there after that heated exchange. It's bringing us to the top of the hour. And for those of you who are, of course, now hearing of it, Joy News is now uncovering that fine detail of the contract that was awarded by the Ghana Airports Company to the Frontier Healthcare Services Limited. Let's try one more time and see if we can get Paul Adomotri much more clear. Mr. Adomotri, we lost you briefly. The point about capacity and also the HEFRA issues I was raising earlier.
I get it. And about capacity and HEFRA, we'll deal with it. I have already dealt with that aspect. Chief, it's important to deal with calling of people names. Senior people, there are people who are on my board who are over 60 years old. They've been chartered accountants forever. And you call them reckless because we go through an RTI law. The law allows exemptions. Parliament passed the exemptions. When Parliament was passing the exemptions, didn't my Honorable Ablakwa see it? Was he not there? And so if we try to access the exemptions passed and accepted by Parliament, we are called reckless. I cannot accept
so I get that
and
point. One more time, the issue society. About why Frontiers and not Noguchi and the others. How about that?
That question you have asked, it has been settled in your answer. There was a process. They went through a process. FDA is involved in the process. Noguchi is involved in the process. The Ministry of Health is involved in the process. You are saying that there's something called HEFA that the emerging company did not have. I have not heard HEFA before. I told your reporter, this is the first time I'm hearing it. I don't know how you came to the conclusion that the emerging company doesn't have it. But if you want to know, then we have to give you the official information. You might as well come back through RTI, but now that it has come to my attention, I will find out. But I don't know how you got to know that the emerging company did not have HEFA. Is it the HEFA people who have told you? Have they written to you to say that? Did you write to request? Did FDA tell you? I don't know where that
and I'm just wondering, as part of due diligence, did you request the company to provide and furnish you with those compliant details before awarding the contract, sir?
From what I have read, in terms of what happened, the FDA was involved. The Food and Drugs Authority were involved, and they certified it. Noguchi was involved with the process. Indeed, in fact, the implementation of the testing, Noguchi was involved. So you are saying there's something called HEFA, and that the emerging company didn't have the HEFA license. What is HEFA? Who told you they didn't have the license? Did the company write
Paul
to you?
Adomotri, I recall the health minister, Paul Adomotri, I recall the health minister saying before the Parliament committee that indeed the company did not have the certification and that subsequently it was done.
But if the health minister said it, why are you asking me?
We're just wondering why it was not done from the start as part of the questions I was asking.
The health minister said it on the floor of Parliament. Now that is public information. We understand. Anything said on the floor of the Parliament is absolute public information. So the health minister said it. He has given the information to the public. A year or 2 years later, you are asking the board member why the health minister said what he said. I don't understand your question. Can you say it again?
Okay, and let's still now, with the way forward, and obviously the reactions that are beginning to
question and accepting that the question you asked must not have been asked. If you are moving away from that and accepting that the question you asked.
I'm just doing that for the sake of time, Paul Adomotri. The final issue about the reactions greeting this, I was just going through some comments online, and of course the suggestion is being made that if this were to be a private firm, many of you sitting on the board would not have allowed this kind of ratio, as Samuel Okudzeto Ablakwa is describing it, a rip-off. As board chair, do you hold a personal opinion on how much this private firm is making or taking home now? It appears we've lost Paul Adomotri there, board chair of the Ghana Airports Company. Unfortunately, to have lost the North-Tong Member of Parliament, Samuel Okudzeto Ablakwa. Kwame Sapong-Asiedu is still with us. Let me give you the final thoughts and see if the lines are much more clearer to you, sir. Your final thoughts on this, sir?
Yeah, Blessed. Just a quick one. There seems not to be a contract between anybody and Frontiers for the actual biomedical testing. I've looked at all the documents that have come out so far. The airport authority rented their space FDR's regulator certified frontiers, but who in Ghana, which institution had an official contract authorizing frontiers to be taking biomedical samples, testing them, maintaining the information, patient identifiable information, which must be data compliant on behalf of Ghanaians? Where is that contract? Because Ghana Airport Authority is telling us now that they didn't have a contract, they only rented a space. That is a huge breach of biomedical regulation. And for me, that is something that needs to be seriously explored. It is something that we cannot just let go. Unfortunately, there is not enough time to. There's a lot that I've read in that document that, for me, I would say perhaps this is the worst contract anybody would sign in the name of Ghana as a Ghanaian. And that's how I'd leave it.
And I'm sure that this is just the beginning of it. Mr. Kwame Sabonasiedu, CDD fellow, also joining the conversation. But unfortunately, we've run out of time. That's all we have for you in this package of Top Story tonight with me, Blessed Sogah. You can log on to myjoyonline.com